afternoon, everyone. Good afternoon, nurses. Just please cooperate and coordinate for a while and lend me your ears for a moment. Okay? Here we'll discuss about the effective documentation practices. Once you hear the word documentation, what comes in your mind? Charting. What else?
Patient.
Okay. Consent. What else?
Papers. Assessment.
Here, as effective documentation practices, improving patient care through accurate documentation and understand the principles and best practices for nursing documentation. This presentation will explore the critical aspect of documentation as outlined by American Nurses Association. We will discuss here the importance of accurate documentation, best practices, and guidelines. Our agenda for today is the introduction, best practices of effective documentation, proper documentation, the principles of nursing documentation, the do's and don'ts of documentation, common documentation errors in our healthcare setting, examples of occurrence that need to be reported, and the critical role of accurate documentation. Now we will begin into the introduction of documentation, emphasizing its importance and role. Next, we will cover the proper documentation techniques, principles, the practical do's and don'ts, and finally discuss the significance of it. As introduction, nursing documentation is a vital component of a patient care. Remember, it is a legal record that provided as essential in ensuring continuity of care beyond effective communication among us nurses and healthcare. Proper documentation ensures patient safety and legal protection in nursing. Accurate documentation is crucial for delivering safe and effective care. It ensures that healthcare team members are informed about the patient conditions, treatment, and facilitating optimal care. What's our role? Documentation plays a pivotal role in patient care by providing comprehensive account of the patient health status, treatments, and responses. It helps to track the progress and that informs us with our future decisions and outcome in the future. Now, let's proceed on the best practice for effective documentation. Enhancing quality documentation must needed by use clear and concise language. Avoid shortcuts, ensure the clarity, be specific, and avoid vague terms. Next is document in real time. Focus on factual information, avoid opinions or any assumptions. Third, follow facility guidelines. We have different protocols here by our physicians so we can follow the guidelines. These are the key elements of nursing documentation. These are vital key elements of nursing documentation that includes patient assessment, nursing interventions, patient responses, and changes in condition. As we have different methods of charting or documenting, such as FDAR, SBAR, or DAR, you can choose whatever documentation you wanted as well as it suits you, as it's make it easier for you. Number 1, maintaining confidentiality. Maintaining confidentiality is an ethical obligation for us nurses. Documentation should be handled and stored securely to protect our patient information from unauthorized access. Ensuring completeness and accuracy. Our vital nursing documentation must ensure all relevant details are included and the information should be precise. Avoid misunderstanding in patient care. Our baseline knowledge we collected to our patients are important and it's a must. Now, let's go to the principles of nursing documentation. Understanding these essential standards, understanding the principles of this documentation, maintaining our essential standards in handling patient care. Number 1 is the timeliness and relevance. It should be timely and relevant to a patient's current condition. Delayed documentation can lead inaccurate and hinder the continuity of care. Clarity and legibility. Clarity and legibility are critical for effective communication in nursing. All entries must be read clearly and understandable. Be consistency and standardized. It helps to practice and to ensure all healthcare providers on the same page regarding patient care. This reduces the errors and enhances communication among us. Now, let's proceed from the do's and don'ts of the documentation. Do's. Always check your spelling. Most of the times, once you open your electronic health record, you will notice the spelling is very wrong. I'll give you one example. The nurse assisted the patient to the hell versus the nurse assisted the patient to the hole. Saan galing yun, guys? Be mindful. Be careful. Next. Patient had pulse daw of 64 versus patient had pulse of 64. Tinulak nyo yung patient. Chart as close time as real possible. Time management. You can practice your time management. If you have a busy shift or what, you can deal with it. Okay? Just remember, finish all your workload in your work time, in your duty hours. So once you go home, hi na lang tayo. Late entry. Common. Yes, I understand. There's a lot of us doing late entries of, what they call this one? Documentation. Because, of course, we have 40 patients, 60 patients a day. Some of us lang. But not all the time. Always verify you are documenting correct patient. You're focusing only on the first name, not in the last name or the middle name. Rim. Yung pala Rima, Aluba. Yung isa pala Rima, Aljusari. That. Don't use unapproved abbreviation or medical terms. In our healthcare setting, only approved medical terms in our clinical setting can be used, but it should be understandable. Alter the medical records or falsify the documents. I'll show you some example of altering the medical records. Now, effective use of narrative documentation. Like what I've said, this provides thorough account of patient interactions. It includes relevant observation and action that we address to our patient. Some common pitfalls to avoid. Vague language. What do you mean vague language? Not clear. Okay, example like kanina. Incomplete entries. Parang, for example, later.
S&E.
S&E, yun ganun lang, not complete. Tapos, pa. CXR. O, yung iba hindi alam yun. Sino alam yun. Continue same treatment. Ganun. So, nurses, you should be aware on that issues. Okay? Now, here, utilizing technology for better documentation. Electronic health record can streamline the documentation process by making it more efficient and organized. Now, let's move on to the common documentation errors in our healthcare. Samples.
Patay.
Okay, illegible handwriting. Present.
Present.
Basa nyo? Can you read this one?
Ay, akala ko yung sulat.
Doctor, ano? Is that a consent?
This is our consent, filler consent. It's understandable. I don't know whose doctor is this, what kind of procedure is this. The name is only HIFA.
There's no pat number.
No pat number.
Date din, wala.
Another thing, once you take a picture for your consent, be mindful. The bottles, the pens are... So this is one kind of eligible handwriting. There's another one.
Kaninong table yan?
Very clear? You know the name? The pat number? No.
Kaninong
So you
kamay
cannot
yan?
understand, right? So miscommunication from the prescription, you will see here. Another thing. Guys, ilan ba ang date? Isa lang, di ba? Please be mindful naman because the date should be only one. Just is an example, okay?
Laser yung isa.
So, yun lang. Yung double entry dates nyo. So, very clear. Clear ba? Blurred. No doctor. Who's the assisting nurse? Who's the witness? If there's no companion with together with the patient, you as nurses will be the witness because this one is a legal document. Next, incomplete information, subjective versus objective language. For example, okay, what do you notice?
Hindi kita.
Okay, guys, ito yung pinakamalaki. Patient came
Izo.
named Janice David Antonio. NP, 28 years old, male, married, complaining of acne on the face, no treatment. No height and weight, of course, kailangan natin. Height and weight must be taken. Duration. See? Duration. No duration at all. No familial history or allergies. So be mindful and vigilant to your nose. Another samples. Again, spelling.
Hindi ko
Guys,
makita.
follow up. LP.
LP.
Alam niyo ba yung LP?
Light check, like and planus.
But most of us doesn't know what's lichen planus is.
Kaya ako median,
So be
parati.
specific. Be systematic on your documentation. And if you want to check your spelling, if it's wrong, there's Google. Just type. The other one. Last visit, LV, kala ko Louis Vuitton. Post-hymen, axilla. There's no diagnosis at all. Right? Just the patient come for Xiomen or for Botox injection in the axilla. And then, what's the proper soap? Xiomen, axilla, done.
Si Yumin, Dr. Lulu
This is
yan.
just by who? By you? So avoid shortcuts. Next, lacks of clarity. What you noticed? Filler injection, volume injection, and pages. In one
Ay, hindi
legend.
ako niyan.
In one
Hindi ako
legend.
niyan.
One color.
Kasi ako nilalagyan ko ng color.
No
Anong
legend
pangalan?
identified, no
Tas ilang
dosage,
cc.
no units, no areas at all. So how you will identify this? Another one. Selfie. Is this a selfie or
Sino
a
yan?
consent or I cannot understand. Sorry.
Sino yung nakamask na yan?
Who's dito?
Naka-blue. Nice clubs.
Photograph? Photo? Is this a selfie? This is what's taken and actual taken attached on the file.
This one?
Yes. Is this proper? You will see. Selfie or photograph. ID picture. Be mindful. Next. I don't know if you were
Lulwa.
endorsing the drawer, the water, the cords, the chair. This is what's attached in the file. Is it proper? Once you forward if someone, for example, as we have one patient
Lulwa yan.
complain for what do you call this one? One patient complained. Then we collected all the consent, the everything. Then this one was forwarded in the MOH. Once the MOH will see this one, would you think what happened to our clinic?
We will not win the case.
We will not win the case. Because you're not only working for Derma Clinic. You're working for your passion, okay? Legal document. Oh, pa.
Ganda
Another
naman
thing.
siya, no?
Oh, wait. See, this was
Ganda
attached
naman
on
siya.
your file. Sorry. Yung
Wala
upper
pa rin
right
yan.
corner, there's no dosage at all. Vulga for 1 week, 180, 105,
Akmad yan kay
300.
Bulga.
Then this one, very cutesy. The soap. Soap is for the doctor's diagnosis. Right, the wrinkles word. Wrinkles. You can check it in the internet. Wrinkles. Siax injection and rejace. No areas or specific area was detailed.
Sinong nagsasayaks?
For example of late entries. See, documentation is not completed in timely manner. It can complicate your patient care timeliness. These are, I seen this one in the TextPen, in our electronic health record. It was discussed, the treatment plan is just like this. Would you think this one is applicable? Seen examined by EP, discuss options for treatment and procedure. That's it.
Iba-iba ang kulay kada.
Number 1, no written consent. Number 2, no digitated. Right? You apply topical. Is the patient have allergies? We don't know. So all are they are question mark. Next. Example occurrence that need to be reported. Sample occurrence in our healthcare settings are the medication errors. Jonah,
Uy,
can you read the
what?
scenario?
Hindi ako makakita. Wait lang. Hindi ko makita kasi.
Come here.
Uy,
Ako makita ko, ikaw makikita.
sige. A nurse in dermatology clinic administers a topical steroid to a patient with eczema. However, due to mix-up in labeling, the nurse applies a high-potency corticosteroid instead of the prescribed low-potency one. Over time, the patient develops skin thinning and other side effects associated with the prolonged use of potent steroids.
So this is one kind of medication error, right? So it is necessary. It is necessary
Hindi
to
ko
rectify
makita,
the
oy.
situation.
Dito
Number 1,
nakikita ko.
always double check your medication labels.
Blurred yung ano.
Okay? And educate your patient about the medication that they are receiving. Not only for Botox.
O, iba naman to.
Robby, please read.
Ay.
Layo. Wait, tayo ako.
Dito pala si Robby.
Thank you so much.
Hindi kasi makita.
Adverse events and incidents. Scenario. A nursing documentation. A nursing documents a patient allergy to a specific medication. In the wrong section of electronic health record, EHR. During a dermatological procedure, the patient inadvertently administer the allergic medication, leading into adverse reactions such as skin irritation and anaphylaxis.
So be mindful regarding our electronic health record. Read the familial history or any history of the patient. Not only just the patient come here. Last, changes in patient condition. A patient with history of eczema has been on a topical corticosteroid, experiences a sudden flare-up, severe itching and redness upon follow-up. The nurses notices signs of discomfort and anxiety during the assessment. Upon further questioning, patient mentioned they are started new over-the-counter supplements. So immediate document all the changes in the patient condition. Is it crucial for ensuring the timely medical intervention? Accurate records must provide in a clear and concise manner. Document as you do. Okay. Our critical role in accurate documentation. 5 key points. Just remember this. Number 1, continuity of care, which provides effective communication among healthcare. Number 2, legal protection. This acts as our legal defense on whatever situation we have. Number 3, quality improvement. Support as clinical audits and performance evaluation in driving patient quality care. Patient safety reduces our risk of errors and enhances our outcomes. Last conclusion. Remember this, nurses. What is not written is not done. What is not documented was not done. Okay? In this conclusion, by adhering this standard and guidelines, nurses can enhance communication, support clinical decision making, and improve patient outcomes. Your commitment to proper documentation upholds the highest standards of integrity, transparency, and professionalism. Together, we ensure that every detail tells a story. Every record builds trust, and every effort makes difference. So let's just continue to document with care and precision, not for ourselves, but for the people we serve. And remember, this will save you in your next 5 to 10 years of your profession once you document in a good and proper, concise manner. Thank you.